Clinical laboratory sections. So the medical laboratory is an area within the healthcare facility where both the inpatient and the outpatient diagnostic testing is conducted. So certain areas of this medical laboratory are designed for clinical analysis, and then other areas are for surgical and anatomical pathology. All right. The medical assistant should be familiar with the following clinical sections. So this is something you should be familiar with: hematology, chemistry, blood bank, and microbiology. Okay, so those are the 4 different sections. Hematology, this is the department that's going to deal with the handling of all the blood specimens. Okay, so all the blood you're drawing when you're going to see the patients, or they're coming to see you if you're an outpatient. This is where the section where all your blood specimens are going to go. These tests are performed or the tests performed in this department include the white blood cell counts, red blood cell counts, hemoglobin, hematocrit, red blood cell indices, and platelet counts. Excuse me. The results of these tests indicate conditions such as like dehydration, anemia, leukemia, and a wide variety of other diseases. All right, so that's the hematology portion. As we move into the chemistry portion, this is where they're going to do some of the testing. So once again, a lot of your testing, a lot of the blood samples that you've gotten are going to this section as well. This is chemistry. You're going to see blood glucose levels, electrolytes, all right, total protein, the serum separator tubes, all right, so the SST tubes. These are commonly delivered to the chemistry department of the laboratory. These results tests can range from the confirmation of pregnancy to the presence of a liver disorder. So there's a wide range there that you can see in the chemistry section. Now, the blood bank, this is the section of the laboratory where blood is collected, stored, and prepared for transfusion. So it is essential for all staff members to comply with the standards for patient identification and specimen handling to make sure the safety of all the patients. So these are the standards that must be followed in the blood bank section. The tests done in the blood bank require a red top, plain tube, or a lavender or pink top tube. The specimens must have the patient's full name and date of birth, the patient's hospital identification number if they are inpatient, and if they are outpatient, their social security number, the date and time of collection, and the medical assistant's initials. All those must be on the tube for the blood bank section. Lastly, we have the microbiology section. This section of the clinical laboratory is going to focus and observe organisms that are not visible to the human eye. So primary sections for this department include parasites, viruses that result in diseases, mycology, which is the study of fungi, bacteriology, the study of bacteria. So that's what the microbiology section is looking at. So there's just a quick synopsis of the different sections of the clinical laboratory. So it's just sort of good to know what they are, what department certain tests are going to.